Well, good evening, ladies and gentlemen. Thank you all for coming out on this rather humid London evening. It's one of the few times I think we're all rather grateful that we're in a venue with air conditioning. I suspect that all of us in this room have dealt with cases where a claimant has suffered what appears to be a fairly minor injury from which a complete recovery might have been expected in a few weeks or a few months, and we see them 3 years down the line and they're complaining of severe, widespread and disabling pain, often not in the same place that they originally suffered an injury, and all of a sudden a case that could have been settled for a modest value some years ago has become a case that's worth a lot of money and that's being fought very hard on both sides, because understandably in these cases insurers and defendants are suspicious of claimants who present in this way. So what happens is the battle lines are drawn, contingents of experts are instructed, and we go and say, well, what's the matter? And we don't get a straightforward answer. We get a bewildering array of diagnoses. From a lay point of view, all of these cases look very similar. You've got somebody who's had a minor accident and is now suffering from a great deal of pain, but we're told it's complex regional pain syndrome sometimes, somatoform disorder, neuropathic pain disorder, fibromyalgia, chronic fatigue syndrome, to name but a few. As lawyers, really all we want is the answer to three questions. Are the symptoms genuine? Were they caused by the accident? And will they get better? But my experience is it's very hard to get an answer from experts to those three questions. And when you do get an answer from one expert, your other expert doesn't agree with it. And certainly the ones on the other side don't agree with it. So we thought it would be a good idea to get two of the leading experts on this subject to come and try and explain in a little more detail what's going on here. Both experts treat patients with chronic pain, but they come at it from completely different disciplines. Dr. Mann Golani is a pain management consultant, and Dr. Master is a consultant psychiatrist. Both will probably be known to many of you as expert witnesses. Raj Mann Golani started life as an anaesthetist, but developed a strong research interest in the neurobiology of pain, and he's been working as a pain management consultant, treating patients for more than 20 years. He's now an honorary consultant at St Thomas Hospital, but he has a very busy private practice both in London and in Cambridge. Aside from his clinical and medico-legal work, he's the organiser of the Cambridge Medico-Legal Forum and a medical legal conference at Peterhouse that has been going on, I think, for about 5 or 10 years now. He's the creator and moderator of an online discussion group for consultants in pain medicine. He's the editor-in-chief of the Journal of Observational Pain Medicine. He's on the council of the London Pain Forum. He's associate advisor to the Parliamentary Health Ombudsman on pain-related matters. And he's recently been elected to the Council of the Royal Society of Medicine. A busy man. So we're very grateful for him coming this evening. Dr. Dinshaw Master is a consultant psychiatrist. He trained at the Maudsley Hospital and was subsequently appointed as a consultant at Guy's Hospital. He was a senior lecturer in psychiatry at Guy's, at King's College and at St Thomas's Hospital. And for many years he was medical director initially of the Lewisham and Guy's Mental Health Trust and later at the Maudsley. To add to his clinical skills, he also has a Master of Laws degree from the University of Wales. And his specialist clinical expertise is in somatoform disorder, or as we would understand it, medically unexplained symptoms. So the plan for this evening is that each of the doctors will give a short presentation of this subject from their own viewpoint. There won't be questions after the first session, but after the second session, we're very keen that there should be some interaction with the doctors, and we'll try and learn a bit more about this subject. In the packs that you've got, you'll find a lilac-coloured sheet, and we'd be very grateful if at the end of the question and answer session, before you come and join us for a drink outside, if you could fill that in and leave it on your seat. I think that's all from me, and we're going to start with Dr. Mann Golani.